Hello, and welcome to our first episode of Roundtable, where we talk about the issues that are important to you. I'm Nancy Schramm. We're here this morning to talk to the experts about heroin, an epidemic that is plaguing our county and our state. I am pleased to welcome our guest, Chief of Police Timothy Altamari.
Thank you for having me.
Director of our Mobile Crisis Teams, Jen Corbin.
Thank you.
And Andrea Wildison, parent who has lived addiction with her son. Andrea, let's begin the discussion by, can you share your family's experience?
Sure. So my son Connor was a typical teenage boy. He was going to one of our public schools in the county. He was on the wrestling team, the lacrosse team, honor roll student, great kid. Could have been anybody's son. So he was on the wrestling team and broke his back in a tournament. And he was given opiate pain meds by a family member, unbeknownst to myself. He started using probably 2 to 3 times a day. Unfortunately for Connor, that one first pill was like magic. He was kind of a high anxiety kid to begin with. That was just his temperament. So when he took that first pill, his brain went, oh, and his back felt better. So he was off and running. It took my husband and I probably about 2 months before we realized that something had changed or that he was using. But when we noticed these behaviors, they were textbook drug abuse. And so while he was at school one day, I went through his room and I found the drugs. I had some experience working in the emergency room at Baltimore Washington Medical Center. I knew what those pills were as soon as I saw them. And that's when our nightmare kind of began. Not knowing where to turn, we called our insurance company. They denied us coverage for inpatient treatment, telling us that he did not qualify. So we went to outpatient therapy, and it ended up being not a good fit for him. He was upset because a lot of the kids there at that particular facility had been sent there court-ordered. They weren't really serious about getting themselves clean. So he came out of there sort of upset. I took 3 months off of work, reattached the umbilical cord, as I like to say. We spent 3 months together. He had been doing very well. He participated in a 12-step program that was very successful for him. In December, he relapsed, and I knew that, and I gave him an ultimatum in our house that that was his safe place, but it was my safe place too, and his brothers and his stepfathers, and we could not have him in the home. He got himself back on track, so we thought. I think he just got a little better at hiding his use, and then he graduated to the heroin. The pills on the street are extremely expensive. Heroin is ready, available, and cheap. And he started using heroin. We went on a family vacation. I had no idea he was using. He was sober on vacation. He was involved with us and the family. I thought things were going really well. The night we got home from vacation, he got with his friends, and I got the call from the hospital that he had overdosed. So I almost lost him. We finally got him into treatment. Really good program, and I'm happy to say after 2.5 long years, he's doing very well. He's clean and sober, been clean and sober for 2.5 years. He is now helping other youth like himself battle this addiction problem. So that's about my story in a nutshell.
Well, thank you very much for sharing, and we're so happy for Connor.
Thank you.
And we know that it's a day-to-day effort, and congratulations, you know, as a mom. I think we all, first thing is priority is our children.
Absolutely.
And I remember in past conversations you telling me that you didn't sleep for 2.5 years.
I sure didn't.
So you're sleeping now, a little bit better?
A little better.
Good, great.
Thanks.
Jen,
Yes.
I think our viewing audience would really like to understand the role of our mobile crisis team and the purpose behind our warm line. Can you tell us a little bit about, if I'm a parent and I recognize I have a loved one in crisis, is the warm line the number I want to call?
Yes, it is. That's the first interceptor into the system of crisis response, where you can call the warm line and from there can access several resources. We're working hand in hand with the health department and their funding as well to get people into treatment. So calling the warm line is a good resource for the parents. But another piece that's also being looked at is we are trying to help the police department with people who overdose by actually going out to the hospitals or reaching out the next day to the family ourselves, because the family might not always want to reach out or might not be able to. So we're reaching out to them and offering the resources we have, which is our mobile crisis teams and our crisis intervention teams, in which we can come out and share the resources and actually help make the phone calls right there to the treatment facilities, because it is difficult to get approval. It is difficult to get inpatient services. And we're starting to have a little bit more success as the information's getting out there and to facilities stepping up to help us, whether it be through OTF funding with the health department or just working hand in hand with the health department and private providers to take the insurance that's out there. And for
Such good news.
our uninsured people, working to get them insurance, our care coordinators at the crisis response system are helping people get the insurance they need so that they can get the treatment. And until they can, we have a grant that we can work with to try and help fund the first part until their insurance becomes active. So we're trying to get them immediate, because we all know that once they go home, their likelihood of using again is high. So the chief and I are really pushing towards trying to get them right after that overdose occurs. But anybody is welcome. There's no wrong call to the warm line. Even if it's just to ask a simple question about benefits, we can help.
Great. Chief Altamari, back on January 27th, the county executive did a public health emergency regarding heroin as an epidemic in our county, and he created the Heroin Action Task Force.
Yes, ma'am.
And he asked all the county agencies to take a look at their best practices and what more we could be doing to eradicate this awful problem that we're faced with because of heroin. And for a lot of families, it's actually prescription drugs. Can you explain to us what new practices are in place for law enforcement?
Sure. As you said, very quickly after he took office, the county executive kind of gave a call to action to all of his department heads. And the message was, no more business as usual. We want to enhance our responses. We want to enhance our ability to be proactive on both helping the folks who need help and dealing with the folks who are poisoning our community. And really across disciplinary lines now, we see communication that in my 22, 23 years as a police officer, I've never seen before. I don't recall ever having regular meetings with the health department, the mental health agency, Jen's folks, private treatment providers. So really the first step was to create an atmosphere of communication, trust, and shared responsibility. And my small portion of that pie, because we can't arrest our way out of this problem, although enforcement is important on this front. My small part of the pie was to enhance our ability to get folks help when they need it, and then to enhance my ability to stop criminal behaviors that result from addiction, and to go after the drug dealers, the people selling poison in our communities and slow death. So what we've done is, for the first time in history, we have an intra-county heroin investigative task force. So I have 2 county detectives, an Annapolis City detective, and this is pretty cool, for the first time ever, a detective from the sheriff's office who actually has a drug detection canine assigned to him. And their job is to go after the heroin dealers from the city line up in the north end of the county down to Annapolis and all the way down south to the Calvert County line and all the borders in between. So If they come across a marijuana distribution case, they'll hand that off. If they come across a cocaine distribution case, they'll hand it off. And they really are focusing solely on the opioids. Andrea mentioned that her son started his cycle of abuse on pills. That is almost a universal story when you talk to folks. I can't tell you how many kids I've seen, and I know they're telling me the truth because I'm seeing their surgery scars somewhere on their body, who say, I started out on pills. By the end, the pills weren't even touching my pain. I needed to do something. And so the pills are very important too. So this task force is working on any opioid. And in addition to that, what we've done enforcement-wise is we've added a drug diversion detective. The National Association of Drug Diversion Investigators was started by Anne Arundel County investigators 20-some years ago. And we needed to add to our capability to get on the front end of things, go out and be proactive in the pharmacies and look for the cycle. So we've added one there. And then I'm proud to announce we've also added a detective to the DEA's fatal heroin overdose task force so that we can kind of forensically reconstruct the spider web that sucked these kids in and find the people who dealt the poison to them and killed them. And then finally, we had to get better at trying to help the folks fighting addiction when we have a chance. And then, as Jen and I talked, crisis time is when they're most likely to listen. When they think, man, I almost died last night, or I'm tired of getting arrested. So we're doing the best we can to reach out to them, extend a helping hand, offer them options. Jen is a magician at figuring things out on that front. So across the boards, we're trying to get better at helping people who need help and removing the people who are poisoning our community.
Well, I'd like to talk a little bit about the Not My Child team that as a result of the County Executive's Heroin Action Task Force, my office, the Office of Constituent Services, we are the connection to the community with the County Executive's office. So we implemented the Not My Child, I call it the awareness program. And you all are very much aware of it because you're members of the team. So because we don't have our prevention specialist here, Andrea, let me ask you, could you help us understand a little bit more about, as a parent, what were those indicators to you that suggested to you that Connor might be, experiencing things he shouldn't be?
They're pretty universal things. Textbook, like I said. Yeah, he was withdrawing from things that he would normally have been engaged in. He is very much like his mother. He's very social and chatty, and he was not at all. He was isolating to his bedroom. He would come in from work or with his friends and go straight upstairs, not stop to talk. He was failing his classes, miserably failing his classes. He was sick. He was showing vomiting, and I'd go upstairs and say, "Are you okay?" "Yeah, I have a migraine today," that kind of thing. So in and of themselves individually, they're all things that teenage boys exhibit from one time to another. Kids get sick, kids isolate, kids don't want to talk to their mom, whatever. But when you put them all together, you have a problem. And probably the biggest thing were his mood swings. Like I said, Connor was always a high anxiety kind of kid. He was always a little bit edgy, but he was never mean. And he'd be fine one day and mean the next. And this is all signs of being an addict. Later on, as we started to uncover things, we also uncovered things were missing from the house. Checks were missing from my husband's checkbook. Criminal behavior had started, and this child, no way had he ever exhibited any signs of intentional wrongdoing. So, like I said, you put all those little things together and you realize you have a big problem.
Right. So I think what's really important to the Not My Child team is that we do outreach into our communities and talk to what I identify as or classify the healthy family, the parents that have children in, that fifth grader that's going to be approaching elementary school because things just really change for a child when they reach those middle school years. So I think it's very important for parents to talk about the problem, to talk about it with one another, because we all don't want to think our children will make a wrong choice, but we all know children do make wrong choices, and the best of kids are making wrong choices. So let's just assume I'm that parent that identifies, oh my gosh, I've got a problem. I think that we really want to express to our community that it's really okay to pick up that phone and call the warm line. There's no embarrassment here. It's all about good health for our children and our community. So Jen, I'm that mom that's on the phone and I'm calling the warm line. Can you describe to me when your team knocks on my door, what am I going to experience?
Sure. It's interesting because a lot of it is the stigma and nobody wanting to reach out.
Absolutely.
And first off, we've started with the whole crisis system going out to and hitting right now the schools and talking to teachers and administrators about reducing that stigma when they see something, whether it be middle school or high school, then reach out to us and then we can come out and do that visit at the house. The nice thing is when we go to knock on your door, we're in a normal car. We're not marked. There are some that have mobile crisis on the side, but for the most part, when they get to the care coordination piece, a care coordinator comes out in a uniform like I'm wearing just to identify us. But it's not a police car that shows up at their house. Nothing is going to happen with them legally. We're going to be coming in to help them make those phone calls. Sit down and get more information, have them tell their story. The key is finding out what worked in the past, what didn't. And doing it in the privacy of your home is kind of nice because when the parent gets to do that, they don't have to worry about people listening or hearing.
And most of us are hysterical when we
Sure.
make that first phone call.
Mm-hmm.
It's a fear.
Yeah, and we want it to be, where they're comfortable and where the client is comfortable, the person who's using, to kind of be able to talk about what's going on with them. We do have teams of two, so what's nice is someone can talk with the parent or the family member while someone's working with the consumer as well. And what's nice on the other side is if it gets a little bit more on the risk side, where they're using right then, they're under the influence, we have our crisis intervention team, which is a mentally health specially trained officer paired with a licensed clinician who comes out, which is something that we've worked really hard at. And by doing that, they get to work with the police department in a very, I kind of like to say therapeutic way, which I know is kind of tough for the officer, but they come in a dress-down uniform. So they have regular BDU pants on and a golf shirt with their badge sewn in, and they're in an unmarked police car. The reason is we want to build rapport with that consumer so that if they do happen to overdose or there happens to be another situation in the home, we can respond and we've built that rapport. And by doing that, doesn't mean that if there's something legal that they unfortunately would have to be charged down the road, but that we can help them through that process as well. We've created a jail diversion program where for minor crimes, we can hold them accountable for the crime, but instead when they're released, they will go straight into treatment, which our team will work with them on linking them. So we're trying to do, it's kind of a softer approach where we do have to fight the legal piece of it, but on the backside we can also treat the therapeutic piece, because going into jail or going in and coming out without the service, they're going to end up right back there, and that's not solving the problem. So the goal is they have to understand there's a consequence, but at the end result, we're there to help you pick up the pieces and get you the treatment you need. And even when they come out and they're successful, we still follow up until the consumer says, I'm okay.
Well, Chief, we know that our police department is designed to police and enforce the law, but we also know that our policemen are very compassionate officers. Can you tell us a little bit about the Good Samaritan law and the use of Narcan?
Sure, absolutely. So the Good Samaritan law was a state piece of legislation that was enacted in October of 2014. And what it did was grant limited immunity to either someone who has suffered from an overdose or someone who is calling to help someone who has suffered from an overdose, so that folks don't feel that they can't call 911 to get the help. Because at the end of the day, saving lives is job number one for Jen's folks, my folks, the whole governmental team, really. So that legislation has made folks feel more comfortable calling to get the help they need earlier when the overdose situation happens. And Narcan, or naloxone, is the actual drug name. Narcan is a brand name. Is a drug that's been around for my whole career, but was carried by ambulance, EMTs, and fire for years and years. And when I was a young cop, it was an injection that the paramedics or EMTs would give when they showed up on the scene of an overdose. And now it has evolved so that there is an intranasal sprayer that we can use to quickly and efficiently get the drug into the victim's body to start counteracting the effects of the opioid that's on board. Because it becomes a micro spray, it gets through the blood vessels in the sinuses very quickly, and it is just as effective as injecting it was years ago. Because it's not injecting it anymore, cops could start carrying it. So also in 2014, the Anne Arundel County Police Department started carrying naloxone. Every patrol officer has a dose with them. When it's used on the street, they go back to the station that same shift, get more naloxone so that they have it. And we've saved a lot of people's lives with it.
Well, it's my understanding that for the year 2014, we were actually losing on average a person a week. And when I look at the numbers this morning, those numbers have decreased. So I don't want to be premature that we've made any huge accomplishments or advancement just in the last 6 months. But at the same time, I'm getting feedback that more and more people are talking and becoming more and more aware through all the efforts and the networking that we've all been going after regarding heroin and addiction. Specifically, again, it's about those prescription drugs. So I'd just like to, in closing, ask our audience to check out your medicine cabinet. Check out, do you have any prescription drugs? They're not being used. Please take the time to remove them. We have drug
disposal boxes.
Drug disposal boxes in each of our police stations, all 4 districts. They are very carefully handled. You can't just flush a prescription drug down the toilet. There's toxins that are not good for all of us. So we're very careful about how we dispose of our medications. So I want everyone to understand just how important it is, because you might be the parent of 4 kids, 2 kids, and they have friends over at the house, and unbeknownst to you, there's one little child in trouble, and that little kid goes into your medicine cabinet, and you've got 15 pills sitting in that bottle, and he takes 2, and you'll never miss them. So we can all work together on this to try to eradicate this horrific problem that we have in the county, because we want everybody to be healthy and live long, healthy lives. Prescription drugs in our medicine cabinet. Does that ring a bell?
That strikes a nerve.
That strikes a nerve.
Yes, that's not as a loud bell. So yeah, if I could piggyback on that for a second. I'm not saying it has never ever happened, but I have never in my experience, and it's been 4 years now that I have been fighting this battle, I've never heard of somebody going and starting with a needle. It always, 90% of the time, starts with a pill. And it unfortunately, these kids especially, and some adults, if they haven't been prescribed it themselves, they are getting it from mom and dad's medicine cabinet. They think it's safe. Some kid told them, hey, we can get high if we mix this with 1 beer. for some people, one pill and one beer is death. You can literally overdose on an opiate with one, and you don't know if that's going to happen to you until it happens to you. Also with addiction, it is hereditary. It is a mind-body disease. It is not a criminal behavior. It runs in my family. I come from a family with alcohol problems, and my son has that genetic propensity. We have talked about that extensively. You said earlier, you know, talk to your kids, talk to your kids. I talk to my kids like crazy. But when presented to them, are they going to hear mom's voice? Not always. So my thing is to get these pills off the street. Thank you for bringing that up and saying, you know, if you have a prescription in your cabinet, get rid of them. Pain never killed anybody. Addiction absolutely kills. And we should all be very responsible. You go to the dentist, you get Vicodin for your tooth, that is an opiate. You have a broken arm and they give you Percocet in the ER, that is an opiate. All of those drugs need to go. And you're not going to get in trouble. That's what people don't understand either. You take those drugs to the police stations and get rid of them. No one's going to ask questions, especially if they're yours. And by all means, if your neighbor says, hey, I know that you had that surgery, did you finish your Percocet or Oxy or whatever? Even if you didn't, don't give them to people. That is against the law, is it not? To give someone your prescription, it could kill somebody. It's that simple. Even if you know that or think that your neighbor is in pain because whatever, just don't. It's against the law and it can kill people.
Well, Andrea, thank you so much. And again, best of luck with Connor and the balance of the family and moving forward, and enjoy the rest of the summer.
Thank you.
That's all the time that we have for the first edition of Roundtable. If you would like to join the fight against heroin, please call my office at 410-222-1785. And please remember the warm line number is 410-768
5522.
5522. I should know that. Anyway, thank you again for coming,
Thanks for having us.
See you next time.